Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. My dear friends, today onwards we will going to start with a new series of talks that is related to challenges in infancy feeding. Okay, during the infancy, what are the challenges that we are facing and how we have to overcome these problems and what is the advice which is required to the parents, and as a doctor how we can help the mother to overcome these infancy feeding problems. Okay, now to start with, WHO position paper and recent evidences, okay, it suggests that the risk of death in the first 28 days of the life is about 33% higher for the newborns who initiated breastfeeding 2 to 23 hours after the birth. Okay, that means those mother who initiated the feeding later, that means not immediately after the birth, they have taken some 24 hours or 48 hours to initiate the breast milk, then the death rate is quite higher. Okay, death in the first 28 days of the life is about 33%. It is 33% higher for the newborns who initiated the breastfeeding 2 to 3 hours after the birth. Okay, so this will increase more than twice as high for those who initiated 1 day or longer after the birth compared to the newborns, so who were put on the breast within the first hour of the birth. That means the message is very clear: those who initiated the breastfeeding as early as possible, half an hour to 1 hour after the delivery, have got the very less risk of a future neonatal or infantile mortality, whereas those who have started later, so they will have the more risk of developing the neonatal problems. Now, fuel deficiency in utero and early part of the life, that means fluid, that means mother is suffering some malnutrition and all those issues. Fuel deficiency in utero and also fuel deficiency in the early part of the life leads to early nutritional programming to thrifty phenotype and Baker's hypothesis. The fuel excess in utero and early postnatal part leads to early onset of metabolic syndrome. Now, introduction of the complementary food before the age of 4 months increase the risk of obesity. Now, that means you should give the breast milk to the child, but instead of giving breast milk, if you give some other food, so that is not good. That leads to so many problems. Okay, for example, introduction of this excess amount of the fuel to the baby, that is in the form of the food other than breast milk, may lead to so many metabolic syndromes also. And thrifty gene hypothesis, you may be knowing it, otherwise you can refer it. Okay, that is also one of the basic problem, even the Barker's hypothesis. Now let us start with the art of infant feeding, how to start feeding. Now, breastfeeding and complementary feeding. See, exclusive breastfeeding we will always suggest for 6 months, first 6 months, and thereafter we will advise to shift for the complementary feeding. So in between there will be a bridge, isn't it? Breastfeeding, exclusive breastfeeding, and now the baby has to shift toward the complementary feeding, and there is a bridge. Okay, so jellyfy, that bridge is called a jellyfy bridge, and it is nothing but family pot feeding with a solid food. Now there is a bridge which is made by the jellyfy. We should think while we are going to complementary feeding, we should be aware of this jellyfy bridge. That means this actually, this will going to suggest how to shift from the exclusive breastfeeding to the complementary breastfeeding. So this is a bridge made by him, the scientist or a doctor. This is a bridge which is made by him for shifting from liquid diet to solid diet in the infant feeding. So we have to make aware of this bridge, which is otherwise called as jellyfy bridge, to convince the or to educate the mother how to shift from a liquid diet to the solid diet. Now, exclusive breastfeeding, that is also a liquid diet. Okay, now from there onwards, child has to shift to the family pot feeding, where we have to introduce the solids. Okay, so now how this has to be done? So that was explained by the Jellyfish Bridge. The period where we shift infant from the liquid diet to the solid diet should be very, very safe and as well as scientific. Now, if you see in terms of Ayurveda, so Ayurveda also first say for first 6 months you have to go for exclusive breastfeeding, Matureva Pibes Sanyam. Then in the 6th month they start with the Phalaprashan, where fruit juices can be given slowly. Then they talks about Annaprashan, where solid food can be given. So similarly, a bridge is explained in the contemporary science also. A period where we shift infant from the liquid diet to the solid diet should be very safe and scientific. Mother has to make the bridge by introducing the semi-solids. So this should be strengthened by the 3 pillars. What are these 3 pillars? These pillars are, that means whenever you are doing this bridge, that means you are shifting from the liquid diet to the solid diet, should always be aware of the 3 things. That means these are the 3 things that I have to keep in mind. Number 1 is, when you are shifting, don't suddenly stop the breastfeeding. Continue the breastfeeding as far as possible. Okay, then give such a food which contains vegetarian protein from the different food groups. It may be dal, chawal or dalia, whatever. And then try to give some of the animal proteins. Okay, vegetable proteins and animal proteins. For if you are using the milk, any bovine milk, so that will provide so much of animal proteins. So these 3 things has to be kept in mind. Now the safety net, now we have to add it to this, a small frequent feeds in between by Akshay Patra method or group eating and supplementary feeding. Okay, now we have added a safety net. What is that? In between all these things, we have to start an Akshaya Patra method. Akshaya Patra method means a pot will be kept or a vessel will be kept. In that, some of the foods will be always kept, just like Akshaya Patra given by Krishna. Okay, so where frequently child has to go and eat something from that particular Akshaya Patra. So that gives some amount of the calories to the baby. Okay, the safety net now we have added to this, that is Akshaya Patra method. A small frequent feeds in between should be given along with this breastfeeding or complementary feeding, whatever you are giving. Along with that, Akshaya Patra method should be also followed. Another is group eating. That means when the elders are eating in the home, the child is also given something to eat. So it may eat a very small amount and it may also spill out, no problem. Okay, it will give some amount of the calories to the child, baby or infant, and also it's a type of education for the child how to eat. Okay, so this is one part. So we will try to look into these problems and how to solve these problems by case. Okay, then the things will be very clear. Now let us discuss about the case number 1. A primary mother, primary mother with no risk factor delivered by LSCS at a maternity home. Okay. Now baby is term baby and weight is about 2.9 kg. Term baby 2.9 kg. Mother is kept in the recovery room for 1 hour and baby is weighed and vitamin K was given. Okay. Both mother and the baby are shifted to the room after some time, maybe after 1 or 2 hours. Mother is under the sedation and the baby is sleepy. Now the thing is, the baby was delivered by LSCS, so anesthetic effect will be definitely there. So she is under sedation and the baby is also sleepy. Baby's grandmother complains that baby is not feeding well on the mother's breast milk and mother has no milk. Now the family members are now bothered. So baby's grandmother complains that baby is not feeding well on the mother's breast milk and mother has no milk. Now the nurse noticed that granny is feeding the honey to the child. And what is the role of prolacteal feeds? Now prelacteal feed and prolacteal feeds are different. Okay, prelacteal means before breast milk. Prolacteal means as a substitute for the breast milk. Okay, so now later granny was convinced that we should not give the prelacteal feeds. Now the grandmother is telling that baby is not latching well and mother is now also worried. Okay, almost like common problem that we encounter. Now prelacteal feed has no benefit other than causing obstruction for the feeding. When you give the prelacteal feeds, prolacteal feed is different. Prelacteal, before the initiation of the lactation, if something you are giving to the baby, it has got no any benefit. It only hinders the normal production of the breast milk by the mother and also breastfeeding by the baby. Okay, early initiation of the colostrum, that means it will cause obstruction to many things. One is it causes obstruction for early initiation of the colostrum and also breastfeeding. Then it delays the exclusive breastfeeding because baby is satisfied by the prelactal feed and baby is not interested to suckle, and when the suckling is not taking place, sucking is not taking place, the breast milk production will not be there and babies will be deprived of colostrum also, which is a very important part in the first part of the breastfeeding. And there is also increased chance of contamination when you are giving this prelactal feed from the outside. Definitely there are a lot of chance of contamination. Okay, so this is one important tip. You should not give the prelactal feeds. Now the question comes in Ayurveda. We always talk about Madhu Ghrita should be given to the baby immediately after birth. Okay, as a part of the Jata Karma Sanskara. Okay, this question always arises. Now, therefore, I am clarifying the things. Prelactal feeds and prolactal feeds. These are two different things. Now, what Madhu and Ghrita which is given in Ayurveda, which is mentioned, that is not a prelactal feed. Okay, it is not a it's not a prelactal feed. Rather, Madhu Ghrita which is given is in a very small amount it is given. Okay, in terms of drops. And idea of giving that drop is just to test the feeding reflexes of the baby, whether baby is, that means Madhu and Ghrita is mixed with some of the drugs and just given for sucking, and that is one of the method followed by Ayurveda to check the feeding reflexes, sucking reflex, rooting reflex and swallowing reflex. If that is okay, then the baby is ready for the feeding, and then mother has to go for the breastfeeding exclusively. One thing. Second one is, this is a simple idea of a trophic feed. That means a small amount of the feed, very minute amount of the feed will be given to initiate the body GAT. In the modern contemporary sense, it is called as trophic feed. Okay, small amount of the feed which is given to stimulate the body, GAT of the baby, so that the peristaltic movement will be initiated, and that is the purpose. So what we talk in terms of Ayurveda, it is not the prelactal feed, it is a prolactal feed. Okay, so increasing the so again, while they are explaining Jata Karma Samskara, a lot of importance has been given, precaution has been taken to prevent the contamination also. Everything is given. Sudhautho, like that, the nails should be trimmed, all the precaution has been given there. So in this case now what happens, they have given the prelactal feed, therefore definitely it will interfere with the breastfeeding in future. So latching will be a big problem. Okay, so latch score, I think everybody may be knowing. Record the first feed and sing a song of that means latch score that we will see. So this is about the latch score. Now the details of the latch score and all those things that we will discuss in the next class. Thank you very much.